What is an intradiscal injection? Well, an intradiscal injection is when we go into the disc and put some medicine in that disc to calm down some of the inflammation there and hopefully calm down some of the pain. If you have pain coming from your disc, you'll likely have what's called axial lower back pain, or pain right across the lower back. It won't be radiating down your legs. It'll usually be worse with sitting, worse with bending forward. That's what's loading the disc, is when you're bending forward, and when you're sitting, you're putting pressure straight through that disc. What we'll do first is usually do some physical therapy, maybe some anti-inflammatories to see if that helps you. If that doesn't work, then we'll get an MRI, because I really want to evaluate that disc, see what it looks like, see what the end plates of the vertebral bodies in the disc, where that junction looks like. If there are modic changes there, and what are modic changes? Modic changes are that inflammation I was talking about between the end plate and between the disc. Or if there's an annular tear in the disc, which is just basically a cut in the disc, just like you can get on any other part of your body, where you can have a cut in the arm, you can have a cut in the disc, that can be causing pain. That pain can be very, very severe, very hard to treat. So what we will do is something called an intradiscal injection, where you come here for another day, we get you on the procedure table. I always say you're here for about an hour total, from the time you hit the door to the time you leave. You will go through your pre-op visit first. In the pre-op, they'll go over all the consent with the nurse, with one of our MAs. They'll go over everything for you. They'll get an IV set up for you. What's the reason for the IV is that we want to give you a little bit of fluids and give you some antibiotics, just to decrease any risk of infection when we're going near the disc. You then get onto the procedure table. We have an x-ray machine that wraps around and shows me exactly where I'm going at all times with the needles. We'll hook you up to some machines to monitor your blood pressure, monitor your heart rate during the injection. Nothing too fancy, just to make sure everything's going well during the procedure. We then start with the procedure. We'll wash off your back, we'll numb up the skin, and we'll take it down, the needle down into the disc. Not much pain. Once you're numbed up, really what you'll feel is pressure. We'll go right into the middle of the disc. We'll inject some contrast there to see the nice flow through the disc, maybe even see that cut, that little cut in the annulus that I was talking about before. Then we'll put some steroid there. We'll use some dexamethasone, very little, and we'll put some Marcaine there, which is some numbing medication to help. We'll also put a little bit of antibiotic right into the disc, the same antibiotic that we give you through your IV, once again to decrease infection. We then pull everything out, needles out, we put a bandage over the area, you go to the post-op area, and you talk to the nurses for 5 to 10 minutes, make sure everything's okay, get a little bit more fluids through your IV, maybe get a snack, get a little something to drink, and you head home that day. We usually see you back 2 to 3 weeks after this procedure to see how you're doing.